Welcome, everyone. I'm Dr. Jessica Seaman, Assistant Dean for Faculty Development in Creighton School of Medicine. Thank you so much for joining us for our Health Sciences Professional Development session, Vicarious Trauma in Diverse Healthcare Providers, How to Promote Resilience by Dr. Nika George. Just a few housekeeping items before I introduce our speaker. This session is being recorded and you will have access to the recording and slide presentation for future reference. We invite you to ask live questions or submit them at the chat. We'll get to as many as we can at the end of the session. We do ask that you remain muted with video off unless asking a live question at the end to assist with the recording. Also, this session is eligible for CE credit, and you'll receive the website and activity code before we conclude. There is a short survey associated with the continuing education, and we thank you in advance for providing feedback as we continue to bring diverse and robust programming here at Creighton. Dr. Nika George is a clinical psychologist based in Omaha. She especially enjoys working with individuals and couples experiencing depression, anxiety, life transitions, or career stress. And she specializes in treating high-achieving clients who experience perfectionism, burnout, compassion fatigue, and PTSD, including that originating from childhood trauma, emotional abuse, and neglect. Dr. George is a contributing faculty member here at Creighton School of Medicine, Department of Psychiatry, and we're so happy she's agreed to share her time and knowledge with us today. So Dr. George, if you're ready, I'll turn it to you.
Thank you so much. I'm really excited to be here, folks. So I appreciate your time. I will go ahead and hold questions to the end. So just go ahead and submit them in the chat. We will definitely have time for that. And we'll go ahead and get started. So we're going to talk a little bit today about learning objectives. We're going to talk about my role, just a brief summary. I want to review the terms vicarious trauma, moral injury. I also want to review PTSD, burnout, compassion fatigue, all of these sorts of things. And I also particularly want to think about how these things affect a diverse range of healthcare providers. And talk about some strategies for resilience among providers. I am going to argue today that most of us as providers are actually experiencing something above burnout, which would be trauma, and that you might choose to treat some of these things a bit different, assuming that it actually is a different origin point, because I think some of the terms burnout fall a little bit short. So a learning objective we have is to understand the difference between typical burnout and a trauma response. And again, I'm going to argue that a lot of us are actually having trauma responses. We're going to discuss how these might affect individuals differently based on gender, ethnic and racial factors, history of trauma in the first place. So like traumas bootstrapping upon one another. We're going to learn about some internal resources for resilience, some external resources for resilience. So we'll have a lot of different options today. So to give some background, my role is I'm a clinical psychologist. I've worked in kind of a series of different hospital settings. My specialization area began as health psychology and trauma. And for the most part, I've worked in hospitals primarily. So I've worked in VA systems, I've worked in private medical care settings, I've worked in rehabilitation facilities, chronic pain clinics, trauma clinics, brain injury, you name it. And I've gotten really familiar with the work of my medical colleagues. I'm often embedded into teams of medical professionals. As we mentioned earlier, I have my PhD in clinical psychology. I'm licensed in Nebraska and several other states. And what I didn't place on here is that I'm actually the owner and founder of Clever Consciousness Behavioral Therapy, which is an online private practice that goes across several different states. So why am I interested in healthcare provider trauma? Well, a little bit started as me search, of course. We started in the field to notice for mental health care providers that a lot of us were leaving the field in droves after the pandemic and during the pandemic. And then we started to also see that this phenomenon was happening in nursing, medical care providers, physical therapy, so just really lots of caregiving professions. And I got a face-to-face look at what that was like, being kind of on the floor with my colleagues and watching some of the unreasonable demands and kind of working conditions really got me interested in the subject and how to clinically help folks who are first-line responders, essentially, and who have had what looks like vicarious trauma. It's interesting because there's kind of sparse research, surprisingly, but this appears pretty frequently in my clinical practice. So I see a lot of physicians, nursing staff, physical therapists, et cetera, who are coming to me seeking care. So let's chat first about the different terminology, and then we can use that terminology to move forward. So most of you are probably familiar with the term burnout. This, I think, is a bit overused, but it is a term that we use. Burnout just symbolizes, it can be from any kind of career stress. It doesn't really have to be from a trauma. It can just be from feeling run down in your career. Essentially, you're feeling exhausted, depersonalized, which means you're just you're a little checked out. You don't really feel like yourself. Particularly in the workplace, you don't really feel confident in your ability to make positive changes towards your career. And you just don't have a lot of compassion for yourself or others. It's just this like prolonged fatigue sensation, and that's burnout. Vicarious trauma and secondary traumatic stress are really, really similar. I'm going to be using vicarious trauma for the majority of this presentation, but you can use them virtually interchangeably. Vicarious trauma are the negative effects of caring about and caring for others, particularly following a traumatic event or context. So we'll talk about what constitutes a trauma, but usually when somebody's had vicarious trauma or is experiencing vicarious trauma, we're starting to see something that goes beyond burnout, where there are shifts in your beliefs about yourself and the world and other people in a way that doesn't feel adaptive to you. It doesn't feel good to you. It's not helping you. You don't feel like it's useful in your relationships. All of us have these changes when we enter a field, of course, like we learn new things. That's normal. That's what we would expect. But it's when these things are not helpful that there's maybe a problem. It's not the same as burnout. It does last much longer, and the symptoms are really similar to PTSD in a lot of ways, and we'll go through that. Secondary traumatic stress is just another term for this, as is compassion fatigue. And again, this implies more than just a temporary stress response. So I want to just parallel that PTSD and vicarious trauma really are similar. In fact, you would diagnose somebody with PTSD, right? If a client came to you, there is no diagnosis of vicarious trauma. Vicarious trauma really just indicates the origin point of the trauma. So PTSD would be somebody has experienced a criterion A, capital T trauma. So there's a lot of like maybe popular information lately that talks about, trauma. Those would be like lowercase t traumas, and those are really more considered stressors. A trauma is something that you are witnessing great human suffering. You have experienced your own great human suffering. This is qualified by feeling like your life, somebody else's life is threatened, interpersonal safety, natural disasters, things like that. And a global pandemic and being in a frontline service industry where you are directly working with patients, and that all qualifies. Most physicians have experienced a trauma, at least of some kind. Now, not everybody develops PTSD from a trauma. Only some subset do. But there are kind of 4 categories of symptoms that you would experience. Intrusions, which are like you can't stop thinking about the event, ruminating about the event or events. Avoidance, so you do things to stop thinking about or feeling things about the event that might not be the most healthy. So like drinking more than you normally would be an example. You have negative changes in your thoughts and your mood. So that's what we talked about earlier. Your beliefs about yourself, the world, and other people begin to change and shift in a way that you're not comfortable with. And your mood is kind of decreased. And then you have changes in arousal and reactivity, which just means kind of like feeling keyed up, intense, on edge, looking around all the time, can present as like irritability in some people or anxiety in other people. I'm going to skip countertransference. That's more for the mental health crowd. So some symptoms of vicarious trauma that mirror this, we're just going to go through more in depth what the feelings are going to look like. So you can kind of notice if you're having any of these things. Would be feeling drained. That's one that matches burnout. Overloaded, just like constantly overwhelmed, like just feeling kind of confused mentally, like you just cannot seem to get on top of things. Anger or rage, like just kind of having a hair trigger. That is actually really a symptom of hypervigilance, like just constantly feeling keyed up. When you feel kind of like fearful and keyed up all the time, a lot of times people present with like outbursts or anger. Feeling depressed, hopeless, lonely, detached, guilty, or doubting, like pervasively too, not just, you know, a couple times a week, but like maybe daily. These feelings start to arise. These are signs that you might have vicarious trauma. Your thoughts may be preoccupied with like clients and work outside of work. And it feels like when you try to break the cycle, you just keep coming back into the cycle. Like you cannot seem to break the rumination about what's happening at work, or what has happened at work. It can be like a past event. You may find that you have more pessimism, cynicism, and nihilism, but in a way that is not typical for you. So some of us are just pessimistic people, and that's totally fine. That can be a personality trait, but it's when it's not serving you or functional that, you know, this may be indicating vicarious trauma. Low job satisfaction. This is another overlap with burnout. And then there are typically 5 areas that we start to see somebody who has vicarious trauma have shifts in their belief system. So that's their feelings about their personal safety, their personal power, their trust for other people and situations, their self-esteem, feelings of ability to have intimacy with others, and their perceptions of their ability to control their environment start to change when they have vicarious trauma. They may even feel more vulnerability to threat, like kind of overestimating, because lots of us are experiencing or exposed to traumas on a daily basis. We start to overestimate the amount of time we personally are going to be exposed to traumatic events. Other symptoms of vicarious trauma that are behavioral, you might see somebody cutting other people off, staying overly busy, avoiding emotional or physical closeness. You might also see, I had mentioned some substance use issues, like anything that looks like avoidance, gambling, maybe kind of like doing things that might temporarily dampen the emotional experience that you're having, but ultimately don't lead to anything productive or helpful for you. Some people say they have difficulty maintaining professional boundaries, like it's just hard for them not to take work home. And you may feel some loss of motivation, even for things that are outside of work that you used to enjoy. You just kind of aren't getting anything from it in the same way. That could be a symptom. And then there are some like clues that you can look at in your organization or wherever you are that might indicate that your career field generally or that organization is experiencing some trauma, and that many of the clinicians are experiencing vicarious trauma. So high job turnover is a big one. Low morale, that one's really easy to pick up on. Absenteeism, and this one, particularly like no calls, no shows, or just people who are kind of cold quitting, like I quit, not even here's a 2 weeks notice, I'm done. That's a sign, because healthcare providers are by and large, they're trying to do the right thing. They're good people, they care. So something has to really be forcing somebody to this level to engage in these behaviors. Like that's not typical of a personality profile of somebody who does this work. So we have to ask, oh, is there maybe something traumatic going on in the environment? Job satisfaction, and then organizational contagion. So there are several things that are going to predict when somebody experiences vicarious trauma. One of the big risk factors is the type of clients that you end up dealing with. And so a really big one is a high demand population. So where there's like kind of constant phone calls, constant emails, even if the emails and phone calls aren't that threatening or terrible, it's just like the volume that can be something. So I hear that a lot in primary care, for example. If the clients who are calling are really highly emotional, so I worked in a substance abuse clinic, and that is like a really high burnout and vicarious trauma caseload, particularly if the clients are emotionally aggressive or emotionally abusive. I don't think we talk about that a lot as providers, but clients can be emotionally abusive towards you, and that can trigger vicarious trauma. And I think a lot of times that can be like normalized in our field, and it really shouldn't be. Just as an aside, like it does have a psychological impact on us as people, as it should, right? Emotional abuse probably should impact you. That is not a good thing to have happen to you. And so, yeah, it will impact you. Working with clients who are hostile or threatening, that's kind of an obvious one. If they have a history of violence towards themselves or others, people who are survivors of trauma or perpetrators, or who are relaying kind of like trauma dumping stories because you're really the only one that's listening, that can be, these can all be client risk factors that would predict a higher likelihood for vicarious trauma. There's job-based risk factors. I think a lot of us are familiar with some of these. So large caseloads, back-to-back clients, back-to-back high acuity clients. If there's not a lot of clinical or peer support in the workplace, or just like kind of a global absence of a leadership figure, that makes it so much harder to consolidate your emotions after an event, because there's not the structural support to take that breather. And so then that can increase the likelihood of experiencing symptoms of vicarious trauma. Fewer resources. So like what I mean by that is I worked in situations where, you know, we have really high acuity clients and there is simply nowhere to send them. Right? Like we're the one-stop shop, we're the end all be all, we fix everything, and we really shouldn't. That's another risk factor for vicarious trauma. And feeling professionally isolated. So just like you don't have a good peer support system, or there's poor collegiality where you're working, can be another risk factor. And then individual history. So everybody comes to the table with a history. We all got into healthcare for a different set of reasons. And some of those reasons aren't always pretty, and wouldn't be the reasons that we say in an interview necessarily. And so I'll just kind of run through a couple of individual history variables that could relate to more vicarious trauma symptoms. So one is if you have any personal trauma history yourself. And that's often more likely, not always true, but is more statistically likely in groups of people of color, people who have low socioeconomic status backgrounds, like first-gen students, first-gen medical providers. LGBTQ community members and women are commonly ones that may have a trauma history. Women often report higher levels of vicarious trauma in the workplace. And I'm not sure if that's what I'm seeing on my caseload, is it's more because women are expected to perform more of the emotional labors. Like people will go to them with trauma dumping stories, even after they have managed a trauma at work. So it just really taps resources. People of color are at a heightened risk because not only, may there be a history of trauma in the past that's statistically more likely, but there's the allostatic load of workplace microaggressions, and just like that background program is always running. And so it becomes harder and harder to divide your resource to protect against trauma. The same issues apply for LGBTQ providers. Also, keep in mind that early career and first generation providers, so folks who are younger in the profession, who just don't have as much seasoning on board, and folks who just feel disenfranchised from both communities. Like, I don't really feel like a physician that I belong in this crowd, and I also don't really feel like I belong with my family where I come from. That loneliness can be a risk factor. Stressors on the job, we've talked about. Feeling like you are not getting anywhere with your personal accomplishments at work, unrealistic expectations of patient recovery. And I think, like, I'm guilty of this. I'd want every single one of every person I've ever seen to get better and to feel excellent tomorrow. But I think there are some realities that are not always consistent with what we want. And sometimes having that viewpoint can be painful and promote more less resilience. And then honestly, if you're just on the same job for a really, really long time, that can do it too. Not with like having like full clinical caseloads and not really having any like admin time or maybe time with students, et cetera. So, what do we do about this sort of thing? How do we manage it? Well, we'll talk about it, but there are going to be some caveats I have here. So first of all, I want you to just pick what works for you. So there's a lot of like stuff out there that's like, have you tried breathing? Have you tried meditation? And that is really helpful for burnout, but that's not the only thing. And I would just encourage you to try what works for you. We're going to be focused more on like, yes, there's that, but what do you also do for trauma? While some of the skills will focus on trying to help you sustain in your current environment, as a therapist, there does come a time where sometimes I see clients and I say, hey, your emotions exist for a reason. If you are feeling consistent fear, anxiety, sadness, and we have done all of the skills to help you improve that fear, anxiety, and sadness, it might just be your environment, and you might just need to get out of a traumatic environment. And that could also, so that's kind of a caveat here. A lot of these skills place onus on the individual. So that old saying, physician, heal thyself. So that's helpful at times. It can make you feel empowered, but just know that I'm well aware that many of the environments and the systems need changing. And I would just keep in mind that we will be talking about that this is like how we address trauma, not necessarily burnout. So one of the first ways to help yourself is awareness building. And I used to, before being more clinical, I think when somebody would say to journal, I almost wanted to scream because it was like, yes, but who has time for that? I will tell you that you can journal to build awareness, but you can also talk out loud to yourself. It sounds crazy, but it works. Even in the car, you can make little mental note recordings for yourself. And the key is to start engaging in some awareness building questions. I do actually, like, if you do have the time, journaling does work because it does activate different neural pathways that help you kind of like engage with the knowledge differently than you would otherwise and encode the knowledge differently than you would otherwise. But it's okay if you do either. Here are some kind of awareness building questions. So what am I feeling? How am I doing today? What specific emotions am I feeling? What specific actions am I taking? And what is going through my mind? You're just getting a litmus test. You're not there to do anything necessarily about it yet, but you're figuring out, okay, what's going on? I'm an observer, I'm a scientist, I'm observing. Now, based on that report, that data report that your mind has given you, what needs do I have and what wants do I have in this day that I can actually meet? Maybe really small. Or what would I like to change? What do I want to do differently? Something small. I think a lot of people too, they come to me and they tell me they just feel completely overwhelmed by their working situation. And so it's important to know what is the hardest part about the work. Make a pie chart for yourself. I know it sounds crazy, but put like top of the list. My email is the thing that drives me most bonkers. And then these like extra little training things, and then lunch meetings, and then my clients, and kind of divide it out so that you know what things specifically to work towards. what worries you about your work. I think a lot of us have like, the litigation stuff is crazy. That's like a common thing, or just like fears about patient interactions. And sometimes getting them out on paper or aloud can just help you kind of alleviate it. And sometimes the worries are kind of far-fetched. So that can be helpful to hear out loud. Ask yourself how you've changed since you started the work, positively or in a way you don't love, just to get that awareness. And are you experiencing any signs of the vicarious trauma that we've talked about? And if so, what have you already tried? Was it effective? Was it ineffective? The other thing, this next question is just, is there anything that you have kind of put away in a box in the back of your mind that has happened, or a couple of things that have happened that you just keep moving past, that feels unspeakable, that you're going to take it with you to your grave? Because I'm here to tell you that it's probably running on a background program and taking some emotional reserve to keep that thing avoided and unprocessed. And how do I find a balance between caring too much and too little? These are just kind of awareness building exercises. There's also some emotion focused behaviors that you can try. Now there's the standard that we all hear: try yoga, relaxation, mindfulness exercises, visualizations. We all know the Headspace app and the Calm app, etc. These are things that are effective. I do think that there is something to be said for mindfulness practice in person, because I do think that the apps can occasionally fall a little bit short on what mindfulness actually is and should be. And a therapist can actually help kind of like process maybe some pitfalls in mindfulness if that's something that you all would feel interested in. It's important to develop a ritual for leaving work. That's just basic classical conditioning, and it helps your brain kind of calm down and relax. So like, you come home, you take your badge off, you wrap it in its little, holder, you put it in the center console, you listen to a song before you enter the house, take a deep breath, and you go in. That could be like a detox ritual for the day. It sends signals to the nervous system that, okay, we're done with this. That can help create a barrier or a boundary. Obviously, engagement in physical exercise and outdoor exercises. They've done research that shows that physical exercise is as effective in some clients as antidepressants. So highly recommend it. Get out of town as much as you possibly can. Changes in your environment can kind of help reset your mental state, and it can get you out of a particular emotional or cognitive set. So I recommend that. Same with spending time with friends and family. Pull away from the isolation, lean into human contact as much as possible. Healthy human contact, I should say. Find your hobbies. Bring signs of beauty or positivity into your workspace. So like green space, photos, areas in Fiji that you want to go to. I don't care, something beautiful to you, something funny to you maybe. I highly recommend also, I noticed that healthcare providers tend to be a pretty creative lot of people, and they seem to get a lot of benefit from creative exercises. So gardening, poetry, writing. And a lot of us lose touch with that when we are working so much. I do highly recommend therapy. It is excellent. It is not just for people who are sick or not doing well. Therapy should be for folks who just want to be doing better. And I think that things are moving in that direction nowadays. I really do I recommend that if you are experiencing signs of vicarious trauma, turn off the news, turn off the social media. You can go back to it. It's not like a permanent state of affairs, but this is a kind of like a needless drain on your energetic resources when you're already impaired. Like if somebody had a cold and their immune system was already impaired, you would not like ask them to do a whole bunch of really stressful activities that further impair their immune system. This is a similar kind of vibe. There are some cognitive or thinking pattern changes you can try to be resilient to vicarious trauma. The very first one is we got to validate and normalize your reactions. So that means you have to acknowledge an emotion, actually that you are experiencing it, or a set of emotions. You must say to yourself that that emotion is acceptable and it's not silly or stupid that you're having that feeling. And it is not just like, well, I'm a doctor and I should be able to do this. That's not true. You're a human being, and you're having a human being reaction to whatever the situation is. We want to also set some realistic expectations for your accomplishments. Know that you're going to make mistakes. Keep in mind that as somebody who is probably likely a highly achiever, your C+ effort is going to be a lot of folks' A+ effort. So maybe there are some things that you can give a little bit less effort to mentally, and that would be okay. You can intentionally kind of fail that task in order to conserve your resources and feel a little bit better emotionally. Practicing failing, not in the department of clients, obviously, but in other areas can sometimes be useful. Adopt an acceptance stance in regards to things you can't fix, and keep a curious and observational mindset. So you want to try to let go of excessive control. I think a lot of us, we want things to look and be a certain way. And instead entering your day with a stance of curiosity of, what's going to happen today? It is not my job to control every single thing that happens today. So I am along for the ride, can be helpful. We all know CBT, actively challenging some negative thinking patterns, can be useful. I will tell you that, I'm the queen of, no, that negative thought I have is actually correct, and I am keeping it. And that's fine. You don't have to change them if you don't want to. But just ask yourself whether it's helpful. You might be right, but is it useful to you to think that way? And if not, maybe it could be useful to challenge the negative thought with alternative evidence, even if you don't necessarily believe it. It's a good thought experiment that can help with emotional flexibility. Gratitude exercises, 3 good things exercises are often useful and promote resilience in people who are exposed to day-to-day trauma. Watching what your clients are doing and seeing the rest of their story, or paying attention to not just the suffering pieces, but the things that they're doing well, can be useful. I highly recommend using humor. Gallows humor exists for a reason. There is a bunch of research to support that those of us with a better sense of humor actually are better at coping and more resilient. So if your sense of humor is, your funny bone hasn't been fed lately, I recommend feeding it in whatever way that feels effective to you. And lots of folks find that spirituality, the research does show that that is protective against traumatic events, and engaging with your spirituality can be useful. That doesn't necessarily mean a religious viewpoint, but like something that brings you meaning and purpose. Self-care at work, I think a lot of us know how to do this already. I touch on it, just to at least give some information. In theory, the research says people should be taking breaks every hour. I think that is not possible for most of us, but at least try to go to the bathroom if you can. Exit the building when possible and change the channel on breaks. Really box out on your breaks when you can. Make sure that you are not talking about work on your breaks, or doing something else. Try a peer consultation group if possible. Having kind of battle buddies can be effective. This doesn't have to be peers in your hospital system even, or where you're working. It can be people from residency, wherever. I have a monthly private practice consultation group with clinicians from all over the country. And honestly, it ends up even more like group therapy after a time. And that's really helpful and effective. You want to share both negative and positive stories in these peer consultation groups. You need to have the balance, because if it becomes kind of just like a kvetching session, then it's not always productive. So you need to have both. And the last thing I have here is don't engage in emotion contagion. So everybody knows that person at work who has really big feelings and they get really amped up. And sometimes when you're in the room with them, like you can kind of feel your feelings amping up. And I really recommend setting clear boundaries with that group or person, and remove yourself as much as possible from that when you can. Okay, I also have here, so I've mentioned therapy a couple of times. I do think that because we would categorize a lot of this as trauma, therapy does end up being fairly effective. There are a lot of trauma-focused therapies that we would use, and this is often what I use in my own private practice. Types of therapies that are useful are the ones that I've listed, and we'll talk about that, but they You don't want to use them like a cookbook protocol. You want to find somebody who is interested in taking a really flexible approach with you, especially being a healthcare provider yourself. You know how it is. It's important to be collaborative. So things that can be useful are prolonged exposure therapy or cognitive processing therapy. Now, both of those therapies are specific to having a history of a traumatic event or two in the workplace or elsewhere. Sometimes traumas bootstrap on one another. So for example, I see a lot of physicians who maybe they had a traumatic loss in childhood, and then they had another traumatic loss of a client or a patient that mirrored a traumatic loss in childhood, and then they're bootstrapping. So in prolonged exposure therapy or cognitive processing therapy, we would kind of expose you to the memory in a very specific way, to each of those memories, and then talk about how it affects your belief systems, and then see if we can kind of get some flexibility there, and decrease the emotional responsiveness to it by getting it out on the table. Acceptance and commitment therapy is also great if it's not if you're just kind of feeling adrift and you're not having this meaning and purpose that you used to have. That can be a great therapy. It's really focused on finding somebody's values, finding what makes them feel most free and most effective in their job, but also as a person. It's got a lot of focus on mindfulness and detaching from thoughts. It's not really whether they're right or wrong, and using emotions as indicators for change. We all know cognitive behavioral therapy. That's just challenging negative thinking patterns and then making outside of work life really big with changes in behaviors. I highly recommend making your outside of work life as big as possible to dilute the traumatic events that can occur in the workplace. And then schema therapy is little known, but I like that one a lot. Is we kind of talk about what core beliefs that developed in your family unit might be playing out actually in a workplace. That's a really fun one to try. It's imagining your work like a big family, which a lot of us do not want to do, but it can be effective in treatment. Types of therapists that there are out there in the world. There's master's level clinicians. So you're going to see licensed clinical social workers out there, LIMHPs, and counselors. Then there are doctoral levels. So that's 5 years of research, clinical work, coursework, and then a 6th or 7th year, depending how long it takes you, and a dissertation, some research studies, and then an internship, and then a residency. And so that'll be a PhD level provider or a PsyD level provider. That's what I am. And then there's kind of I put other category, which is you can sometimes see faith-based counselors out there, life coaches. And I've also noticed there's a growing group of physician coaches, which they seem to be hybridizing, I think, some version of therapy and health coaching. So how to find a therapist who does this sort of thing, because it is happening. Therapists are doing this sort of thing. If you need this sort of thing, it's available. So there's the traditional method of just calling your insurance, seeing who's in network, and then going to their website and looking at their reviews. That's not my favorite method, but it is a method. A second, slightly better method is to contact psychiatrists or social workers that you've worked with and just ask for recommendations for people in the area. Lots of us are part of therapist network groups. And even if we can't treat you ourselves, we might know somebody in the group, in the network, who specializes in this sort of work. My personal favorite way to find somebody who's really good for you, because I think a lot of us as healthcare providers were kind of sketched out by asking people, hey, do you know a good therapist? So this is a little bit more private. There are 2 or 3 different kinds of directories that contain therapists. My personal favorite one is ZenCare, but there's Therapy Done or Psychology Today. I know, for example, on ZenCare, you can ask for the level of provider, master's, doctoral level, et cetera. You can say specifically, I want somebody who treats healthcare focused trauma, and somebody who treats childhood trauma, and then they got to use these types of treatments. You can get a really specific list, which is nice. And they have to have telehealth appointments because I'm busy, for example. Or you can simply just do therapist near me. I don't super recommend that, but that's an option. And I will also put the caveat out there that it's really a lot more common to start to see therapists leaving insurance panels for a variety of reasons, which are, I personally believe, quite good reasons. So try not to be sketched out by that, because that is something that is really common these days. And it can improve quality and access to care for folks who are willing to do that option. They can get in a little bit quicker just because there's less wait lists. If you are looking at a therapist, whether they're on or off insurance doesn't matter, but look for somebody who mentions some level of evidence-based care. You want them to have a clear statement about their treatment philosophy. Like, what are the things they believe? What are they bringing to the table? What do they want to offer you? I would shy away from folks offering like really flashy kind of snake oil sounding treatments. If anybody says they're going to cure you in like 3 sessions for $49.99, that's not anything, and that's not going to be effective. I would shy away from big club conglomerates. I'm not a big fan of BetterHelp or Cerebral. I do know that there can be positive experiences out there, so I'm not saying they're all terrible, but the clients I have now are not sharing positive experiences. That's just been my personal anecdotal work history. You can always look up a provider's license number to make sure they don't have any active or ongoing issues, and then look at their reviews, see if they have any. A good provider will always offer you a free consultation for fit. So it's really common for people to interview therapists. The 2 things that predict positive outcome in therapy is you liking your therapist and them actually giving you outside of session skills for practice. And so you want to actually talk to them on the phone or via email for 5 seconds to make sure you are interested in pursuing some sort of discussion with them. And consultations are usually free. They're 10 to 15 minutes. And if you see that that person, their website seems to share that they're an expert in everything, that is also not anything. That'd be like saying, yeah, I'm a cardiologist and a primary care doc, and I work in the liver disease clinic. Like that's not something that we do as mental health providers. So this is just some education for if you are experiencing any of these things and you do need to find somebody out there. If you have any questions, so I have a website for my own practice. There's a tab on it that talks about all the different types of therapies that I referenced here, and it like goes through them in a little bit more detail. So I just thought that's cool. If you have any, it's just got a couple of different paragraphs. It's a really quick and dirty summary of the different types of therapy. So if you ever get curious, if you need to reach out to me for any reason or find me, there's my contact information. And here are some references. I will head to the last page just for continuing education credit information. And I will, I suppose, open it up to questions. I don't know if I see the chat.
Thank you so much, Dr. George.
Of course.
You gave so many different providers tangible resources. So we appreciate that. I do have a question that was already shared with me. So I'll start with that one. As people are thinking of questions, then they can put those in the chat as well. So the first question I got is, I think they were thinking of the symptoms of vicarious trauma. Is it also possible to have unrealistic positivity, happiness, manic type behavior, not always negative?
Absolutely. Absolutely. And I think that can, that dovetails with a person's individual history. But let's say, it's pretty common, like lots of healthcare providers describe to me that they have like a history of maybe bipolar 2. And so like in the phases where they're hypomanic, they get a lot done. It's not always a bad thing, honestly. Everything develops for a reason. And so like it could be a symptom of actually some stress that's going on when like suddenly you're like a lot more kind of elevated, a lot more productive. It doesn't necessarily mean you have bipolar, but like that can be a symptom of stress. Alternately, that can also just be a symptom of like hypervigilance, like this like chronic busy upbeat, like, I'm good, I'm okay. Like if you feel like you're white knuckling, that can certainly be something. So yeah, it doesn't always have to, that's a really good point. It doesn't always have to look like negativity. It can be kind of like, I don't want to call it toxic positivity, but like positivity that isn't always like helpful, you know?
Right. I think that's what they were asking about. They were
Referencing.
getting at, because
Great question.
sometimes unrealistic positivity can come across as just, it's not realistic anymore, and
Yeah.
it's not real. And so it can be confusing as well.
Yeah. Of
Okay, very good. Thank you for answering that. I'm getting a
course.
lot of, this has been an excellent presentation. I wish
Ooh.
more of my colleagues could have been on, but we are recording and we are going to be able to get that out to people that maybe the timing didn't work out for them.
Yeah.
If
No
anybody would
problem.
like to unmute and ask a live question, you're welcome to do that as well. And you can have a conversation with Dr. George.
We'll add, just when you want to unmute, interrupt me, please. I will just add a little interesting bit of information. There is a new bit of legislation that allows doctoral level clinicians to practice telehealth across state lines. So some of us, including myself, are certified to do that. So when you are like looking for someone, you may find that that person could be in another state, but that would actually be normal. That's not like, so like I could treat somebody in Arizona, but I don't actually think there is a mechanism for that for master's level clinicians just yet, but just thought I'd offer that quick tidbit.
Well, that's good to know.
Yeah.
Some are asking for your contact again, so I'm just going to
Nice.
throw that right in the chat.
Yeah. Yeah, I will say, so I am accepting clients right now. I am getting like way more busy than I had ever imagined. So if it takes me, 24 hours to respond, I do get to it. It is just, I did not anticipate the love that I would experience from clients in the community. And I'm very much enjoying it, but it might take me a second to respond, particularly because I'm teaching at UNL for a day this semester. And after that, I'll have even more opening.
Awesome. I threw that in there. I threw her website in there, as well as her phone and email that she shared with all of us. So anybody have any other questions?
There's a question in the chat. What are some signs that you need to end a relationship with a therapist?
Oh God, that's such a great question. Let me see that I can give a good answer that isn't too negative. Okay. So if the therapy, one common thing I've been hearing recently for people calling me is that they're telling me that the therapist is like self-disclosing a lot of information. That's a no-go. So if somebody is like spending more time in your session talking about themselves, their personal history, their issues, that's not what I would call ethical. That's a problem, and I would probably get out of there with a safe, soft place to land. So that's one issue. If billing practices are not transparent and they're billing you more than they said they would bill you, if they're saying that you need to come in like 3-4 times a week, that's a lot. Really, we just see people once a week at the max. Sometimes twice a week if there's this like really intense stressor, but that's really rare. Let's see, if it becomes clear that that person is trying to enter a multiple relationship with you. So what I mean is like they're trying to be your friend, or they're trying to like contact you outside of therapy session hours, or you have contact with them outside of therapy session hours. They're trying to date you. They're trying to take you on a cruise. They're trying to take you out to dinner. Any of that. No. Bad. A good therapist they can use self-disclosure and be friendly and humorous and kind, and they might use like a 30 second to 1 minute self-disclosure to make a point for you about your own progress, but it always comes back to you. So those are some indicators that there's something negative going on. Oh, falling asleep in session, showing up late to session. Yeah, that sort of stuff, not okay. Hopefully that answered the question. Good question.
Some of you were letting me know that the code wasn't taking you to your certificate. But I've already reached out to the CE office. They've already fixed that. So if you happened to not get a certificate, make sure that you just go right back to this website and put in the code. And it's just a few questions. So we appreciate your patience with that. And I do not see any other questions. So we may give you a gift of time back. If there's anything else that you want to mention, Dr. George, then we'll let you have the last word.
Hang in there, guys. Hang in there, everybody. This is the roughest part of the year. I get a lot of calls at this time of year. Something about the lack of sunlight, the winter plus work stress makes people really tense. And even if you are not the one that's tense, you are probably dealing with people that are tense. And I wish you all the best. So hang in there.